What does it take to keep a vision on track? What does it take to keep an ideal on the move? What does it take to keep a legend on the rails? To keep it traveling year after year, calling at faraway places, at distant stations, on its restless quest to make a difference to the lives of millions. For 18 years, since the dawn of democracy in South Africa, the Transnet Phelophepa health train has become a familiar sight on the landscape of change, bringing the promise of good, clean health to communities that lie beyond the main line of the State Health Service. Many know it as the Wonder Train, the Miracle Train, the train of hope and healing. And yet, there is nothing miraculous about its continuing success. For the Transnet Phelophepa owes its reputation as a flagship of corporate social investment and a benchmark in the delivery of primary health care to a combination of technological excellence and human expertise. Reflected as much in the tireless dedication of its onboard manager, its 20 full-time staff, 16 security staff, 40 volunteer final year students from across the country, as in its upholding of the highest standards of clinical integrity, financial management and control, and sound corporate governance. Recognized around the world for its innovation and service, the Transnet Phelophepa has won many awards, including a United Nations Service Award and the Sigma Theta Tau Award, regarded as the Oscar of nursing. Proof that this is a train fueled by the passion and compassion of its people, as they set off on their mission to leave a legacy of quality care, of upliftment and education, by helping to make people healthier today and to build a healthier nation tomorrow. Now, that mission, that legacy continues as a new Transnet Phelophepa gets ready to take to the rails. The Transnet Phelophepa 2, a proud project of Transnet Rail Engineering, an operating division of Transnet, will offer the same health services as its predecessor and will be even more technologically advanced with enhanced electrical and data communication systems, air conditioning, ablution, wheelchair platform lifts, and the latest in medical equipment technology. Already, the Transnet Phelophepa has touched the lives of more than 20 million people. Now it stands ready to reach out and make a difference to millions more. Not just one train, but two. A vision, an ideal, a legend, brought to life through the generosity of public and private benefactors, the commitment of its people, and the spirit of the nation that inspires it. Come, join us now as we step on board for a closer look at the working heart and soul of the Phelophepa. The journey to good, clean health begins with knowledge. And here, on the Health Clinic of the Train, fully sponsored by Hoffman F. LaRoche and staffed by 3 highly experienced professional nurses and community nursing students, the ancient dictum at the heart of medicine, know thyself, is given new meaning through a program of education and screening that holds valuable lessons for patients and students alike. Lessons of awareness through consultations that test for minor ailments and seek to ward off the prospect of chronic disease. Lessons of outreach and empowerment through visits to schools, farms, and centers for the aged. with a mobile unit generously sponsored by the Swiss friends of Transnet Phelophepa. As well as through the training of community volunteers who will carry on the good work long after the train has left the station. Lessons of healthier living and lifestyle management, delivered with passion and purpose by a team of dedicated individuals who travel the extra mile on their quest to bring the vision of the Transnet Phelophepa to life. Here, at the eye clinic of the Transnet Phelophepa, a better life is in sight for the hundreds of patients who are seen to every day. Screened for a variety of ocular conditions and fitted, if necessary, with prescription spectacles, cut and beveled in a state-of-the-art laboratory right on board the train. Patients over the age of 16 are asked to pay a nominal fee for the spectacles, in line with the Phelophepa's philosophy that payment adds dignity to the service. The eye clinic, introduced by Professor Yanni Ferreira from the University of Johannesburg, was the first clinic of the Phelophepa, and in these two coaches, that visionary tradition continues. Under the expert supervision of 3 optometrists and an optical technician, these final-year optometry students are given the privilege of putting theory into practice, leaving their patients ready to look at the world in a whole new light. The light of good, clean health. The light of the Transnet Phelophepa. Basic dental hygiene is a fundamental of primary health care. And that explains why this is one of the busiest clinics on the train. In these 5 fully equipped cubicles, with equipment and consumables partially sponsored by Colgate-Palmolive and 3M, patients can have their teeth cleaned, restored, or in extreme cases, extracted. Here too, patients over 16 pay a nominal fee for these services. The clinic is staffed by 2 dentists, an infection control nurse, and an oral hygienist, whose greater goal, beyond the doors of this train, is to send out a message of good dental care by word of mouth. The clinic's school outreach program, sponsored by Colgate-Palmolive, screens learners from grades R to 3, helping to put a happy smile on hundreds of faces. Well-being. In a healthy society, it should be the natural state of body and mind. In truth, it is a fleeting and elusive goal for many. Particularly in parts of the country where poverty compounds a range of social ills that can have an adverse effect on mental health. Here, the psychology clinic of the Phelophepa has a role to play in helping to redress the balance. Staffed by a psychologist and final-year psychology students, the clinic offers individual counseling sessions and psycho-educational workshops. Partly sponsored by Air Liquide, the clinic reaches out too to learners and adults in communities beyond the rails, offering support, understanding, and therapy through such innovative tools as this multimedia interactive puppet theatre, which focuses on helping learners cope with bullying at school. In addition to its on-board services, the psychology clinic also facilitates a program of self-discovery and healing workshops called The Journey, through which a qualified journey practitioner uses techniques of visualization to help individuals conquer negative emotions and set foot on the path to a better, healthier life in mind, spirit, and body. Quality, dignity, respect. The Phelophepa's prescription for dispensing good, clean health. But sometimes, those who visit the train's clinics need medicine too. And that's where the onboard pharmacy, fully sponsored by Roche, stands ready to answer the call. Staffed by 2 pharmacists and final-year students from academic institutions, The pharmacy provides support for all 4 clinics and carries a minimum of 4 weeks' stock to serve patients who will often have walked for hours to visit the train. With an average of 4 items per script, charged at a nominal fee of 5 Rand per script, some 100,000 items are dispensed during the 9 months of every year that the Transnet Phelophepa is on the rails. Sensitive to culture and levels of literacy, the pharmacy staff use pictograms and avoid complex medical terms when interacting with patients. Proof that here, on the Transnet Phelophepa, the best medicine is Ubuntu. For the full-time staff and students on board the Transnet Phelophepa, this is more than a train. More than a symbol of hope and the promise of good, clean health. This is a place to call home, thanks to the hard work and expertise of the dedicated catering, technical, security, and logistics teams. The train is able to run on schedule and meet its commitment to the thousands of South Africans who have come to look forward to its calling. As the train sets off every year on its mission, it is backed by a massive support operation that will see some 450 meals served a day, some 20,000 litres of water used every week, and some 15,000 litres of diesel fuel burned per month, enough to power a small town for 2 weeks. But the real power of the Phelophepa, the real energy, the real fuel, is the spirit and ethos of its people, the drive and determination of those on board to make a difference, to set the highest standard for more than 11 hours each day, to leave a legacy of trust and caring, of quality, dignity and respect for all whose lives have been touched by the calling of the miracle train, the train of good, clean health. The train they call the Transnet Phelophepa.